Hi, this is Dr. Warner. Today I wanted to talk to you about stem cells. I've been getting a lot of questions and phone calls asking me about stem cells from both my peers and colleagues to family and friends. A lot of people don't really understand these things. They're extremely powerful biological cells within the human body that allow for growth and regeneration. So this is that term, regenerative medicine. This is very tightly regulated by the FDA and becoming more so because there's a lot of fly-by-night clinics that are opening up and doing a lot of things they're not supposed to be doing in terms of stem cells. We in orthopedics have been using stem cells for years. We just haven't really called them that. What we've done is whenever we have a fracture that needs to heal or a non-union, which means a bone that didn't heal or something that's having trouble, we've gone into the pelvis. This is a pelvis, specifically the iliac crest, which is right here on the top of your hip, and we've taken bone out of it. And then you transfer that bone where you need to, be it a foot, a knee, a femur, whatever. The cells in that bone have what are called mesenchymal stem cells and hematopoietic as well. And these become cells that then turn into bone-forming cells, blood vessel-forming cells, tissue-forming cells, what have you. So we've been calling that bone grafting, specifically an iliac crest bone graft procedure. Well, now I've modified it down for the past, decade or so. I aspirate blood from the bone marrow of the crest and mix it with bone graft, and it's just as effective and much less painful. So for years, over a decade, I've been using stem cells. We just don't call it that. Now I guess we need to. Anyway, what is a stem cell? A stem cell is exactly what it sounds like. You have a stem, right, in a glass, or you have a sentence stem, or you have a stem and leaves coming off of it, flower, whatever. So think of the stem as the source, the core. So a stem cell, well, that's a cell and that's a nucleus, is a cell that has the power to become what it wants. So in this case, an adult mesenchymal stem cell, okay, and that's an important distinction. This is not embryonic, okay? This is not anything from fetal tissue. An adult mesenchymal stem cell taken from bone marrow can be centrifuged, which is considered minimal manipulation by the FDA, which is legal. A lot of places are doing things that the FDA does not like. We don't do that. You take it and you can get it to form bone, which is an osteoblast. It can become tendon, or what people really want to hear is it can become cartilage. So why does that matter? What is cartilage? Cartilage is the surface of a bone. So you have a bone, and normally you have this nice smooth surface. See that? That's your cartilage. You have the other side of the bone, another nice smooth surface, and that's a joint. That's what moves. So my elbow has cartilage, my neck has cartilage, my wrist, etc. When you get arthritis, you start to get pock marks and divots and rivets. It's almost like a road in New Orleans. Very damaged, very irritating, lots of crepitous bony motion. It hurts when you move the joint. The hope is, and the holy grail of orthopedic treatment and really all regenerative medicine, is you take one of these guys, you process it out of the bone marrow, focus it, get as many as you can, which is the centrifugation. That's the machine that spins it out real quick. And you basically use a device. There's an FDA-approved device out there that we use in surgery to process the blood, to get as many of these things as you can into a concentrated aliquot or injection amount. And then you put it into the joint. So then there are your stem cells. They're bathing the joint. When they're in that environment, the thought is the stem cell will preferentially differentiate into whatever it's around. So, birds of a feather flock together. You put a mesenchymal stem cell in a cartilage bath, so to speak, and the hope is that it becomes a cartilage-forming cell. Once you have a cartilage-forming cell, you can form cartilage. Problem with us, meaning adults, middle-aged and beyond, we lose more and more of these tissue-forming cells in each set of tissue. Salamanders can grow a tail when it gets cut off. We can't do that. This is the thought, that we take a mesenchymal stem cell from the bone marrow, appropriately processed the way the FDA likes us to do it, and in the same surgical setting, you put it in the tissue that you want it to go to. Has to be a similar tissue. This is collagen to collagen, and that's basically it. And so that's what the big deal is. It's trying to regenerate and form tissue that's been damaged by life. So hope that answers your questions, and have a great weekend.